Great. So thanks very much. I'd just like to do a little starter. I'd like to thank Paolo Belli, introduce Paolo Belli, who's visiting DC, although lived here many years ago. Both Catherine and I know Paolo well from having worked in South Africa in years. But Paolo is the program lead for human development in 7 countries of Southern Africa. He previously worked in Eastern Europe, working with the World Bank. He previously worked with the World Bank in Eastern Europe, and before that in South Asia, and before that was at Harvard. So he brings a rich experience from around the world, and it was great that he agreed to come and talk to us about his work with the World Bank in Southern Africa. So without further ado, I'd like to thank you very much for coming, and hand over to you, Paolo, for your talk. Thanks very much.
Thank you. So it's a pleasure to be here. It's the first time I come up here, so it's really a pleasure to be here. I read a lot of your work around the world, but I never had the pleasure to be here at your headquarters. And so today I'm going to talk about, let's say, starting from the 10,000 meters picture about the economies of these countries and what are then the key challenges in human development. And then we move on, and I will briefly explain to you what the bank is doing in some of these countries, how we're trying to tackle some of the challenges. So when we talk about human development in the World Bank, we actually basically mean 4 sectors or areas. One is health, one is education, one is social protection, and the 4th one is jobs. And you will see also that I have an emphasis on actual issues of youth employment, which are very critical in this cluster of countries. So I will be talking about all these 4 sectors. And please feel free to interrupt me or make comments or questions. Let's try to make this a dialogue. So this is the plan, to talk about the key development issues, and then move on and start more, let's say, a World Bank focused approach, a snapshot of what we're doing in this cluster of countries. So the first key, let's say, fact to point out is that this is a cluster of countries that has real challenges in reducing poverty. In all of these countries, even those who are middle-income countries, such as Namibia or Botswana or South Africa, you still have very large pockets of the population who have not benefited from economic growth. So if you take, for example, South Africa, if you take $3.10 a day as a threshold, you have about 35% of the population that falls below that threshold. And if you take $1.9 a day, which is international measures of extreme poverty now, you have about 16.5 now of the population below that threshold. So key challenges in terms of poverty reduction across the region. The second feature, which is actually unique of these countries, is that they have huge levels of inequality. If you take like the Gini coefficient as a measure of inequality, I think 6 of the 10 countries that have the highest Gini coefficient in the world are actually in this area. So you have a problem of economic growth, but also you have another bigger problem of inequality, of sharing of the benefits of economic growth. And each country sort of has a slightly different history and set of reasons why economic growth has not been shared. But this is the key challenge. And since the bank has, our twin goals are reducing poverty and boosting shared prosperity. So this is really like a cluster of countries where our mission objectives seem to be very relevant and very central actually to the development challenges of this country. So it's not only an issue of increasing growth, but it's also an issue of making growth more inclusive. Now, the other key feature, again, moving from the highest level, the other key feature is that these countries are not moving in the right direction. And I'll just give you 2 examples from South Africa and Zambia, but I could present the same slides about the other 5 countries. So the countries I'm talking about are Zambia, Zimbabwe, Namibia, Botswana, South Africa, Lesotho, and Swaziland. So these are the countries that I cover in my country management unit. So if you take, for example, South Africa, you see that after the last global economic crisis, 2008, 2009, you don't see any further improvement in poverty reduction or in reduction of inequality. So the country is basically stuck. And if you take the period before that, you do see some reduction in poverty, but frankly, actually disappointing results in terms of inequality. So the Gini coefficient in this decade, 2000, 2010, is actually has increased in South Africa. So even after the end of apartheid, when the country had a phase of growth, the growth was not benefiting the poor part of the population. Inequality increased. And this is the number I was showing you. So about 8.6 million people living below this $1.9 dollar a day threshold. Take Zambia. So take a look at this part of the graph. Zambia actually has grown over the last decade, on average at 7.4%. So the cake has grown, but inequality has grown even faster. So the share that goes to the poor has decreased. So if you look at the measure of poverty is on the left-hand side, this is extreme poverty. This is the $1.9 a day measure, the same as for the other, for South Africa. You see that actually rural poverty has increased between 2010 and 2015. And this is actually in a phase where the country was growing at 7.4%. So growth not benefiting the poor. Most of these poor are in Zambia are in rural areas. This is very different from South Africa. But in 80% of the poor in Zambia are still in rural areas. And if you look at the international, let's say, comparison, so you have poverty here, extreme poverty actually, 1.9, and the Gini coefficient, you would see that all the countries, I put here South Africa and Zambia, but would be the same actually so Botswana and Namibia would be very similar to South Africa.
Quickly, I'm sorry, the online audience. Okay.
Just put instead of my glasses. Okay, good. So there are sort of outliers in terms of inequality and in terms of poverty. South Africa being now actually the country with I think the highest Gini coefficient in the world. I think is 0.69 for income and is 0.63 for consumption. So primary countries with huge challenges in poverty and inequality, and things are not moving in the right direction. And something else that characterizes this country, and this is very different from the rest of Sub-Saharan Africa. And in this respect, Zambia is actually an exception. But for all the other countries, they've already had quite significant reductions in fertility rates over the last 20 years. So they are actually entering the phase where they could actually benefit from a demographic dividend. So in all of these countries, you have a huge youth age cohort coming into the labor market now, and you have very low dependency ratios because the number of kids has been decreasing. At the same time, the number of elderly is not yet increasing very, very rapidly. So you actually are you have the same population structure that you had in China like 30 years ago. I'm talking about all the countries with the exception of Zambia. Well, actually, Zambia, I think, is still the third country in the world in terms of fertility rates. And it's doubling its population every 21 years. But not the other ones, not the other two. So that could be actually a very promising, let's say, demographic structure for this country. But it could actually also turn into a demographic bomb, in a sense that all these countries are characterized by very large levels of unemployment, but also specifically youth unemployment, and also very low participation rates in the labor market. So that actually creates a situation where you have hundreds of thousands of youth that are not studying, are not working, and many of them are not even looking for work. They're sort of discouraged, which is a very sort of socially unstable situation. So look at the labor force participation. and look at the labor force participation amongst youth, aged between 15 and 24, they're extremely low. So if you look at countries in Eastern Asia, that would be around 83, 84%. And the level of unemployment among the youth is about 50%. This is South Africa, and again, the similar, if I show you the numbers for Namibia, for Botswana, that would actually be very similar. So demographic dividend or demographic, a huge challenge also in terms of social cohesion. Please.
Hi, clarifying question. For the unemployment, is that encompassing of both formal and informal sector?
Yes. Now, if you now zoom down to like specific sectors that I work on, starting from health, and again, here I sort of want to emphasize again more the challenges. I mean, there are a lot of, let's say, positive things going on. For example, in the health sector around this region, in terms of there has been real progress in terms of treatment of HIV positive, but there are still huge challenges. So we talk about this quadruple burden of disease, where you have still a very high level of prevalence of and 52% of the total HIV infection in this is 2014 are actually from one of these 7-country clusters. In this cluster, you also have Swaziland and Lesotho, which are actually now the countries with the highest prevalence of HIV in the world. So a huge challenge on an unfinished agenda for HIV AIDS, maternal and child health challenges. Again, countries sort of have improved, but they also actually failed to achieve the NCDs in terms of reduction in maternal and child health. And you have, and this is specific for the more affluent population and emerging, but it's also affecting all the others, an emerging NCD challenge, but also really very much, they are also sort of outliers in terms of what is called external death, so violent, accidental, violent death and death for suicide and others. So, for example, in South Africa, the rate of homicide, I think it's 32 per 100,000, which is, and I think the global one is 6 per 100,000. So you have a combination of important challenges, and in the sense that the health system are not really, and as I said, with exceptions, because there are also positive developments, but overall they're not really able to respond to these challenges. In most of these countries, the health system is mostly still input financed. So all these countries still allocate the budget according to historical expenditure and line items. There is not much accountability for performance. There are issues in drug procurement and drug management, drug logistics management. And also, and you see that increasingly happening also in countries such as Zimbabwe, or also the poorer countries, they reach opt-out and use the private sector if they can. And in South Africa and in Namibia and Botswana, the private sector is mostly funded out of insurance premiums. In South Africa, it's about 16.5% of the population that uses that is insured, and they consume about 50% of the total. Actually, it's about 150 billion rand, which is more or less the same that is spent on the other 83.5% of the population that uses the public sector. Recently, a public expenditure review in Zimbabwe, and we were surprised actually to see also how it's much stronger than we thought it would be. It's about 25% of the total that goes to the health sector through private insurance premiums. So even in countries that are poor, you still see that trend of the rich basically and the civil servants creating a parallel system for themselves and use the different facilities for the rest of the population. Now, so this is an illustration from Zimbabwe, and again, similar, perhaps not as extreme trends you would see also in the other countries, for example, in Lesotho. So there is a disproportionate share of the total that goes as salaries, employment costs, and there are very little controls on this money. So there are no clear performance measures or other incentives to actually make sure that that money is used properly and efficiently. And also there is a disproportionate amount going for curative services And specifically, like in Zimbabwe, if I remember correctly, there are 5 hospitals, major hospitals at the provincial level that absorb about 35% of the total amount spent in the health sector. In Lesotho, that would be even more extreme because the single tertiary care hospital, which is run with a typically absorbs about 30% of the total amount of the amount spent in the sector. Now, moving now to education, here, and this is actually for I think for health as well, but the education has been much more rigorously proved and backed with evidence. There is a huge quality challenge. So most of these countries have been really making improvements in terms of gross enrollment, particularly for primary education. So most of the kids now go to school for at least 4 or 5 years, but most of these kids are not learning in school. So you have this huge quality challenge, and these parts of countries, if international, so recently the TEAMS test results came out, and actually score at the bottom of the global ranking, let's say, in terms of results, and with a huge, again, variability compared to other countries. So you have, for example, like in South Africa, the 10% best schools, sort of in those schools the kids perform more or less at the same level as the average school in the United States, but then you have a very long tail, a large number of schools where performance is really poor. So this is from the work of an education economist that teaches at Stellenbosch University, and some countries of this cluster have not done the PISA, but they've done the TEAMS. And so here basically extrapolated the TEAMS results and with countries that have had the same TEAMS results and calculated what would have been the PISA results if the country were also were doing the PISA. And basically you see that all these countries really score very poorly. Again, an issue of lack of accountability for performance, in the case of teachers and support staff. And there is also, I would say, an access, unfinished agenda there, because in many countries, in many of these countries, people, yes, they do start school, but they drop out before. So even in South Africa, half of the kids still drop out before they reach the matrix, which is at the end of grade 12. In other countries, it's even darker. So you have, for example, we work in Zambia. In Zambia, I think only approximately 25% of the kids reach secondary school, so from grade 9, and more drop out. And the dropouts are also disproportionately amongst girls. So you have a huge problem of access at a higher grade and bringing these kids up to a level of, at least finishing secondary school with basic skills. Here is from South Africa. This is from the national test, and you can see this was the grade. Kids were asked to read a sentence and then to explain what it meant. And you can see that in grade 4 children, on average in the country, 29% were not able to read a sentence, and then a much higher proportion, almost 60%, could not tell what was the meaning. And I remember also from this TEAMS test, I looked at some of the numbers. So the TEAMS test is for grade 5, and one of the questions was, what is 40 minus 28? And in South Africa, 24% of the kids got it right. So very simple subtraction with 2 digits. Majority of the kids, after being in school 5 years, were not able to. So really extreme challenges in the education sector. In social protection, we have really, let's say, mainly 2 clusters of countries. You have countries such as South Africa, Botswana, that have, so none of these countries has a contributory system developed. But in some countries, they have a non-contributory system of social protection, so mostly social safety net, which is quite developed. So in South Africa and in Botswana, absorbs more than 4% of GDP. And in other countries, they have now a well-targeted scheme, which is in Zambia and in Lesotho, where it's conditional cash transfer in Zambia and unconditional cash transfer in Lesotho. And Swaziland and Zimbabwe don't have developed social safety net system. But these systems are still very, very fragmented and very blind. So in South Africa, for example, SASSA pays almost 17 million every month child support grants to the population. It's about, I think, now 320 rands, plus many other benefits. But they don't have even, like, say, a household identifier that would allow them to know whether a household is receiving 1 or 3 or 5 or 11 of such benefits, depending on the composition of the household, nor they know, because it's based on a self-declaration, nor they have been able to match that data set, let's say, with asset ownership data set, to see whether there is any fraud or nor they know whether these families have kids in school or there is nutrition challenge in the household, etc. So it's a very, very fragmented system that has actually in South Africa been important probably to keep, let's say, social cohesion in such an extreme inequality, but it's not been developed to the next step that would actually allow to take intelligent decisions on how to manage it and how to reach those who are not reached and on how to combine the benefits so that to maximize the impact. There is also an issue. We've done this analysis as part of a demographic study recently. Because of the low number of elderly and the much higher number of kids, even in countries that said have reduced fertility rate, if you compare benefits on a per capita basis, actually the system of social protection seems to be skewed in favor of the elderly. So guarantees some cash, some basic, but it's not very, very good at actually at promotion, at actually protecting children and providing some cash to families with a large number of children. And this is something that, again, moving forward, something that we've tried to push in South Africa, but also in other countries, to try to create, this is the example of Chile, so at least start from having like a territorial information system, which also has an inventory of all the social benefits programs, let's say, starting from the townships, to understand what are the different benefits, social benefits. This could be occupational health benefits, pensions, it could be child support grants, it could be other services. We just don't know. We'll never put them together. So to build a territorial mapping of which services are given to whom, and then over time moving it to the household level. So having a household identifier for all these benefits that would allow us then to have like a tailored approach to each individual household. So creating basically a unified registry of beneficiaries, as many Latin American countries have done in the last 10 years, not only Chile. Now, the last block is jobs. I was telling you that this is also another area where we have a program that I oversee, and again, as I was explaining to you, very, very, very severe challenges in terms of youth employment and in terms of informality. So those who find jobs find informal, low productivity jobs in general. And then obviously there are, I want to show you this slide. So there are complicated factors in determining the situation. So we work on HD mostly on the supply side. So we work on issues of skill formation, but also matching in the labor market. In South Africa, there is now a very interesting experience with Arambi, which is an NGO that has started. I don't know whether any of you have ever worked with them or knows about them, but they have basically they pick up kids and they train them mainly on soft skills, help them to write a curriculum, and then they test them again mostly on soft skills. And the 20% that perform best in this score are given an internship in a company for a year. And the company appreciates that because it's a signal for them that these kids have at least the basic skill of reliability, punctuality, etc. And so it has been funded also by a set of private companies. But there are many others of such experiences. I mean, so these are the supply side. And then obviously there are the demand side. I mean, this is an economy. South Africa last year, I think, created 163,000 jobs in the whole country. So I mean, there are issues related to the demand side of labor that we're not addressing actually in our sector. There are broad macro fiscal as well as sectoral issues that prevent. But this is and then there are actually issues related to the way the institution work and the matching. In South Africa, another big challenge is that people live very far away from their jobs. So, and this is because of the apartheid urban structure, so that, most of the, or particularly low-skilled people still live very far away from the city centers where most of the jobs are, and there are barriers in terms of transport costs. So now going back to the, so I was showing you, again, these countries with this very, very severe issues of youth employment and but also adult unemployment. And this is you know, and again, we're going back always to the same story. You know, these are economies that, in order to really address this issue of growth and inequality, they need to produce jobs. They need to produce particularly formal jobs. So this is, so you can see here, this is the poverty rate according to a different survey. This is it's 420 rand per day, I think, poverty rate. For those who are inactive, unemployed, employed, so employment makes the biggest difference. And then amongst those who are employed, if you are formally employed, basically you make it out of poverty. If you are informal unemployed, you have much better chances, but you still have some. And again, look at also the skills. No, there is and this is true again across countries. You have a large premium of completing in South Africa the metrics, but also then moving on to higher education. A large premium to being educated. So these are the so this is as I say, the first part of the presentation. Then I move very briefly to discuss with you what we do. But if there are any questions, again, I wanted to point out mostly at the challenges. And this is not to say there are things that are moving in the right direction, but you don't see it yet in the larger picture. And the challenges seem sometimes unsurmountable actually when you look at countries such as South Africa. But please, any questions or comments? I mean, some of you work in this region.
Can I ask about the, you got out there about urbanization, with those stats that you showed earlier on, I mean, presumably there must be some big shifts going on in countries and across countries to big cities and such like. Is that presumably that's something coming up as a future challenge?
Yeah, so in terms of urbanization, there are, let's say, two groups of countries. You have countries such as Zambia, where this is, I mean, you don't see yet massive movements of population. Lusaka has grown a lot, but there is no growth in secondary city, and the majority of the population, I think 60+% is still in rural areas, and as I said, 80% plus of the poor. And then you have countries such as South Africa, where yes, you have had actually it's almost like in the years of apartheid, there was almost like a forced urbanization, no? In the sense that people were brought to work in the mines, but let's say the process of urbanization is very advanced. We have very few people, comparatively speaking, still in the rural area. So the challenge is different in different countries. In many of these countries, what the bank is trying to do is to also help develop secondary cities. So that, for example, a country like such as Zambia is very much still Lusaka-centric. There is no other city that has the level of economic dynamism that Lusaka has. It's a country that already has almost 16 million people and again growing. And so that is the process of urbanization, in a sense, yes, adds to the challenge, but also adds to the potential opportunity. And this is actually what I wanted to show in this slide. So there are, let's say, these are sort of underlying tectonic changes on which we have very little influence. No, climate change, urbanization, demographic changes. And then, we need to work within these underground, let's say, trends and try to actually achieve these objectives of reduction of poverty and inequality, try to provide better opportunities for the youth and improve quality and equity of service delivery. But these factors will actually influence also the way we can do it. So, for example, talking about demography, which is something I'm more familiar with, if you have a country such as Zambia that is growing at 3% a year, sometimes you feel like you're running just to stay in the same place. For example, in terms of education infrastructure, you still have to continuously build new schools, hire new teachers, just to accommodate this incredible growth in the population. So that adds to the challenge. When you have a country such as South Africa, you, in a sense, you will have less children. So in South Africa, about 1 million children born every year this year. So and it's going down every year. So you have some fiscal space also to focus on and spend more per child and work more on education quality, etc., rather than only on access. So So we basically, these are like our broad objective we want to have selective operations, selective projects, but also analytical work to address some of these challenges. And provide knowledge as well as sometimes financial and operational solutions to the government. And these are the three sectors. I sort of put labor under social protection or youth employment under social protection. And there are clearly also, what this slide wants also to show that there are common and cross-cutting challenges. So, for example, if we're talking about improving, let's say, health financing and risk pooling, this actually has a social protection dimension, as well as malnutrition has a social protection, strong actual social protection. It's not about food, it's about a series of, and actually that also includes education. Then, so a lot of the work that we are doing is increasing, actually. The bank has gone through this reform 3 years ago. We have created 14 global practices, and the risk is that each of them sort of works in a silos. But actually, we see at the country level that a lot of the challenges are actually cross-sectoral, and so we really need to, and this is part of my job, to force the GP, the global practices, to work together. And so this is actually rooted in our priorities are rooted in some of the global priorities that we have as an institution in human development. But also, what I wanted to point out is that it's also rooted in some of the same priorities that you see in official documents. I mean, whether they're actually then corresponded by the actual policies is a different matter. But if you take, for example, the National Development Plan of Botswana or Zambia or South Africa, they clearly have the same indicators, sometimes even the same indicators that we use in terms of poverty reduction, in terms of boosting shared prosperity. Whether, as I said, whether those are then translated in actual effective policies, I think there is a long way to go. But we really work within the frame of national documents that actually state the same priorities. So this is some of our strengths, I think, in this sub-region. We do impact evaluation. For example, we have now a large program to assess the new adherence policies for HIV AIDS in South Africa. But we have other rigorous impact evaluation, for example, of cash benefits in Zambia and others. So we have a very, in general, broad and strong technical basis. And we are doing more and more, let's say, innovative operations. So we have this results-based financing operation, or for our, also in the health sector, we have one, for example, in Lesotho, one in Zambia, and one which is trust-funded is in Zimbabwe, RBS. So where we ask facilities to open a bank account, primary care centers, and we give money to the primary care centers based on results agreed, and where some of that money, usually is about between 50 to 75%, can be used for investments at the primary care center level, and the other 20% or 25 or 30% can be used for individual bonuses to the staff that works in that center. We do the same in other sectors as well. And this is just one example. So these are some of the areas where we are engaged. Again, you can sort of group them under three buckets: poverty, economic growth, poverty and inclusion, and sustainability. We have, for example, in South Africa, but also now regionally, we have a project in 4 countries, a TB project, which is focusing particularly on minors community, where you still have prevalence rates above 2,500 per 100,000. And so we are trying to focus on those communities and try to reduce their incidence of TB and improve occupational health services more broadly. So these are all areas where we work, and this is the division in our, let's say, administrative budget across all those areas. And then there are new things that we are trying to do more, which were not done in the past. One is the area of nutrition, where there is a huge challenge. For example, in Zambia, 41% of the kids are stunted. And this reflects also the high levels of inequality that we're talking about. And we're trying to start looking at what others are doing and see whether there are gaps where we could do more. We have very good experiences of reduction of malnutrition, for example, in Peru and other countries. We would like to replicate that. We would like to work more on gender-specific issues. So we have one project specific on gender. We would like to do more. It's called JEWEL, Girls' Education and Women Empowerment and Livelihood Project in Zambia. And this project is doing 2 things. One is giving bursaries and a support system to girls in secondary school so that they remain in school, 15,000 girls. and also giving $200 to 75,000 rural women, able to work rural women, together with some training on how to do business, and then a mentoring program to connect them to market. So, for example, if they produce food, to link them to the school feeding program. So this is it's the only project we have which is focused only on women. We would like to do more. Again, we have a sort of a small budget. We have a portfolio about $4.5 billion, but you need to consider that $3 billion of that is the ESCO project in South Africa. It's an energy project. So actually, our whole portfolio is not very significant if you take that out compared to other regions also where I worked before. And this is, again, for historical reasons. We have our administrative budget every year is about $12 million, which is divided across the 14 global practices. So we are relatively small. And this is my last slide. These are some of the highlights. So I already talked to you about the girls' education, and I also already talked to you about this TB in the mine. We have a very successful Zimbabwe Health RBS. And this is very important for us because we cannot lend to Zimbabwe because Zimbabwe is in arrears. You know, the Zimbabwe government owes $1.2 billion to the bank for the last 15 years. So, but we can still be engaged and use this grant money that we can use actually to support at least one sector. We actually have other grants in other sectors. And it's been very successful and increased the institutional delivery by 14% more than in the district where it was not implemented. We have a rigorous impact evaluation of this project. We have an activity in Lesotho, which is, again, an RBS. It's relatively young, it's 2 years old, and we also have started again to support, to try to fix some of the issues in the hospital PPP. We have a project in Swaziland, which is both health and social protection. So the social protection part is really interesting. It's a grant. It's the first cash transfer in Swaziland. I mean, targeting the orphans. So these are children that have lost at least one parent, and it's very innovative in the way these kids are. It's about 7,000 beneficiaries, and also in the way the benefits are paid. So we use instead of cash on hand, we use mobile solutions and other mechanisms to actually pay the benefits to the families of these kids. Let's see how it works. It's a relatively new project also. And we have a lot of analytical work in demography, nutrition, and financing, skills and labor market, and some new operations in the pipeline. So this is very brief. Again, I could go on and on, but this is what I give you, just a snapshot of what we're doing. Again, the size of the challenges are gigantic, and we are a small player in this. But this is sort of in a nutshell what we're doing, at least in the sector that I sort of oversee. Thank you.
Okay, thanks very much. That's great, and we still have time. That's presentation, very, very interesting. So opening up, any comments, questions, points? Sharon.
So I appreciate the highlighting the intersectoral or linkages or between work streams. And the SDGs, of course, emphasize the importance of doing that. I'm wondering if you could talk a little bit more about barriers to actually making that happen, or ways that both within the World Bank and at the country level, and or ways that you've been able to kind of examples of successes that you've had.
I think it is a challenge, and it is a challenge not only because of the way we are organized now with this, with global practices, but also the way the counterparts are organized, where they also don't talk to each other, the different ministries or the different parts of the same ministry, which makes it a challenge. We were recently, now we are discussing, in the last couple of days we were having a discussion on Zambia, and there really, what you see is that there is a huge issue of agriculture productivity. It is not improving. You have this maize monoculture. This is one of the reasons why children have these problems of malnutrition, because they eat only maize. I mean, and we have had many projects in agriculture, and so we are not. I mean, this really requires a combination of interventions, you know, in land ownership, water, access to markets, social protection support for the poor. So it's not, there are sort of also three groups of families, reform of the subsidies. So the three groups of families are those who produce something but not enough even to eat, so they need to buy extra food. Then there are those who are sort of more or less self-sufficient. And then it's about one-third. And then there is one-third of the families that actually have excess production, and then they can sell some of it. So, but also the challenges for each of these three groups are very different. And again, we would require a complete, like, multi-sectoral approach, which could bring together many sectors. I mean, the other example is nutrition. And to be honest with you, I mean, there are not many success stories yet to tell. But I do see that, yeah, I mean, with sectoral intervention, we are sort of limited sometimes in what we can do. I mean, these other issue that I think is very much cross-sectoral is this issue of youth employment and which has, you know, an education component, a social protection component, and then let's say a business climate component, and also it's related to many other issues. You know, the issues of you know, we know this, for example, you know, that one of the clearly let's say two. I mean, the deprived population, the population that are not, that don't have access to the labor market or are excluded from school, are those who are then also most vulnerable for HIV AIDS and many other. So all these things are related. I mean, sometimes, you know, you start from one place and then you discover that you should actually, that is not really the reason. I mean, one example, I mean, in Zambia we've done this analysis last year that showed that most of the girls leave school when they become pregnant. So that seems to be actually a more important factor. I mean, according to our results of the study, that even the economic condition of the girls. But that is also related to the fact that a lot of these girls are supported financially by older men that want sex. So there are so anyway, there are all these dynamics that, you know, we have just started, I think, to understand.
We have something online?
Yeah, so we have a question from Paolo.
Okay.
And he says, what are the operational lessons from the attempts at shifting from input-based financing to results-based?
Yeah, so again, he knows more than I do on this topic, so he should not ask the question. But let's say, this is my take. Again, it really depends on what is the binding constraint. For example, in Zimbabwe, in my own view, it has worked really well. Why? Because in that situation, you know, the government is only paying salaries. There's no money for anything else. And this is true both in health and education. So this RBF money has given individual facilities, for the first time in many years, some cash they can actually use to pay for anything else. You know, whether it's a piece of equipment that needs to be repaired, or the water connection that is not working, or some extra drugs that are absolutely essential. So it's not so much the individual incentive that has made a difference, at least in Zimbabwe, I would say, but it's really like it's been the channeling of the money down to the facility level and allow flexibility in the use of that money. And that is the Zimbabwe story. I'm sure that in other countries we could actually probably tell a different story. But the other issue that I've seen, and this is true also, I would say, in Lesotho and true at least partially in Zambia, is that it has allowed to shift the focus from into what really matters, because, you know, these are the service delivery indicators we all care about, you know, level of immunization, level of institutional deliveries, et cetera, TB cure rate. And so now these indicators are actually taken much more seriously, and there is a whole system of monitoring which is actually quite robust that has been created around this project for measuring where we are on these indicators. So the emphasis is shifted from input into output. So my sense, but again, Abdul and others are better experts than I do, is that we are always sometimes sort of barking under the wrong tree, in the sense that we emphasize, when we talk about these RBS, we emphasize the individual extra payment side of it. But in many cases, that's not the most important factor, actually. I mean, I'm sorry that Abdi is not here, otherwise I would like to hear.
You may better come on and let's keep going, Kate.
Hi, thank you. And I'm curious if you're looking at gender empowerment in the health workforce. You're probably aware there's a lot of discussion about that now, since women make up a large part of the health workforce. So that's something you've been exploring through policies or programs.
Do you want to take it?
My question kind of goes more at a more macro level. There's a lot of economic migration Zimbabwe. Is there any study or any say with regards to your analysis that highlights in terms of that?
Yeah. So I would say that both questions that are both very important issues, and those are both issues where we are deficient. I mean, like, I don't think that we have done. I mean, yes, at the margin we have, for example, in our project in Swaziland, we very much emphasize and we are investing also physically in nursing schools and as a to increase the presence of trained nurses around the country. But this is as far as we go, which is not what you were asking. So on migration again, I think that it's one of those issues where as you're right, I mean the movements are massive, and we have done work on related to the TB in the mine task, where we've done a lot of work actually in understanding where these miners came from and where and actually the study showed that up to 50% of the miners are coming from one of 4 countries actually bordering South Africa, Mozambique, Swaziland, Lesotho, and Zimbabwe. And these are all workers that go and work in the mines, I don't know, when they're 16, 17, 18, and then they stay, but then they go home regularly because their families actually stay at home. And also then is the challenge of, let's say, if they are TB patients, then we try to have the government establish a system so that they can receive also the medicine when they go home. And we've done a geographical mapping actually that allows you to see with GPS where these mining hosts communities are in these countries and how they travel to South Africa. But again, this is just a very small part of the overall picture. And as you know, South Africa, for example, now is changing immigration laws, making them much more restrictive. I think they're also, in a sense, missing, and we have not done enough homework on our side, missing the important economic contribution of migrants in South Africa. Where, a lot of the key workers, for example, in my experience, are Zimbabwean. But again, the bank unfortunately has not done much analytical work on this issue yet. I think we're pushed now to do more, and quite right.
Can I just have a follow-up question on that?
Yeah.
About to what degree are these countries working together? Because I know there's all these attempts breaking down barriers to trade, but as you say, there's in South Africa they also want to build a wall and things, if they could. So are countries working together to get better sort of economic integration, improve trade relations, or do you think going the other way?
My own sense, and again, this is based also on everything I've heard from other colleagues, that this is actually one of the key challenges in Africa, that there is very poor economic integration amongst countries. I mean, if you compare with other regions, for example, in Europe now 60% of the GDP is on inter-country trade, and in Africa I think is around 15-16%. So it's very low level of economic integration. As you know, they have the SACU arrangement, so the revenue from imports duties is shared, and actually that creates also, in my view, a very strong vulnerability in some of these other countries, and specifically Swaziland, Lesotho, and Botswana, because they depend heavily on these SACU revenues, and the SACU revenues are very volatile. So, for example, in the last few years of this economic recession, they've decreased quite. I think the decrease has been from 27% of some of these countries' GDP down to 13 or 14%. So these create a huge economic, the fiscal shocks for these countries. And last year, the fiscal deficit was 16% in Swaziland, was 14% in Lesotho. I mean, these countries are completely dependent. They've not created their own tax base. They completely depend on SACU revenue. So that is let's say, a non-so-positive economic integration. And but I think that in general, the level of trade and the level of exchange among these countries is way below where it should be and it could be. And we hear all these stories about how costly it is to bring goods from one country to the next and to transport them, and the fact that a lot of the perishable goods actually cannot cross the border in time to be usable across the border. So I think I think the area, how to strengthen integration is really a key issue. Another issue now is the energy. South Africa traditionally had, the last 3 or 4 years, and traditionally had a surplus energy, but then it went into a phase where it had a deficit, and now it's again producing a surplus because energy. So a few coal plants came into, but they are not able to sell the excess energy to neighboring countries. So even to create like a power pool, so that countries that are producing excess energy can actually trade in real time with others and sell or buy energy. I mean, these type of arrangements are not formalized yet.
2 from online. I'll go with the first one. There is Krina Patel from USAID, is a new Foreign Service Officer, and is wondering if you could speak more about the World Bank areas of collaboration with other development partners.
Yeah.
In the region.
So let's say, it's sort of different in the different countries, I would say. In South Africa, I think the level of collaboration is still relatively weak. If I look also across sectors, we don't have, well, also related to the fact that we don't have much of a portfolio in South Africa, but we do exchange sometimes information and agree on strategies, but it's a very informal and very in some other countries, I think we are in a better position. So, for example, in Swaziland, our health project is co-funded by the EU, so it has a grant component, which is about 1/3 of the total. So it was a way actually for the government of Swaziland to soften the terms of the loan, because Swaziland is an IBRD country, and so the EU agreed to pay for one component of the project. They're putting about, as I said, 1/3 of the total as in forms of a grant. And we are agreeing we had agreement, the project was prepared, but now in implementation also we agree on messages to government and really coordinate very closely with them. To some extent, but not with the pooling of funds. That is also happening in Lesotho, for example, in our social protection reform that we are promoting a project there, which is about reducing the number of ghost pensioners and then unifying and strengthening and better targeting their social protection and social assistance programs. We are also very closely coordinating with UNICEF and with the EU. As I said, in other countries, I think the collaboration could be stronger. I mean, sometimes, you have the same experience around other countries as well. My own experience, more than 20 years ago, that finally frequently boils down to individuals and whether they are closely associated, but there is not like a very conducive environment to make it happen, actually. So in many countries, you have a feeling that the different donors, particularly in the health sector, are sort of wild cats that are very difficult to bring together and to agree on. So I think there is a lot of scope for improvement, actually.
Maybe have one last question.
If there's one.
Anyone else in the room?
Paolo, did you already talk about kind of where you see governance arising in the health or other sectors? And is the bank doing anything specific to improve governance?
Yeah, no, I think it has a huge impact, and unfortunately not very positive impact. And let's say to start from the supply side, the picture that you see in many of these countries is that they have very, very poor control mechanisms at the level of, let's say, the budget design or budget execution that allows them to really see how their money is spent and to try to, which actually would be absolutely necessary to then understand how it could be reallocated in a more rational or equitable. So it's really, just one example, because it's sort of extreme, but I've seen this in other countries faster as well. I was recently in Lesotho, we're doing a public expenditure review, and so first of all, the government of Lesotho, that even after I mean, this is just the tip of the iceberg, but like they have, if you look at their recurrent expenditure, their capital expenditure managed under two different accounting systems. One is called IFMIS and the other one is called TOMPRO, and they don't exchange data. And so in the Ministry of Health, there is the recurrent expenditure is recorded in one system, and the capital expenditure is actually, it's not capital, it's development expenditure, because some of it is actually recurrent. Most of it is just donor funded or donor supported. It's recorded in another system, in many other systems actually, which are then aggregated in this TOMPRO system. And the data keeps changing. So even after the IFMIS, even if after it is the accountant general, so to revise it, it keeps changing. So you can actually access it online if you have the password. So I accessed it in August and then back again in February, and the data was different from 2012-13. So they don't have even this minimum, let's say, control mechanism to understand, to have, an actual expenditure number that everybody can. This is just, again, it just gives you a sense of the. And then they're very, very poor controls. I mean, wherever you look, I mean, we were looking at this in the Ministry of Social Development, this bursary scheme that benefits higher education students. And there is actually a small number of them, but it's disproportionately costly. It's more than 4% of GDP. And the deal with these students is that they should repay actually after they finish their, but there is no tracking system, there is no mechanism to actually trace what these former students that receive these benefits are, and it's 140,000 rand on average. So it's a lot of money for a country. So again, you have this sense that the basic control mechanisms are not in place. And then, when you go into looking at procurement, again, major issues of single source procurement in contract that should be competitive, et cetera, et cetera. So there is a lot to do to actually, and this improvement in PFM and then human resource management. This is another key issue. I mean, for all these sectors, it's actually perhaps the key issue. How to establish mechanisms that you have a rational system of selecting staff and then making sure there is a career progress linked to results, et cetera, et cetera. All of that does not exist. So a long way to go.
Well, we have to end there. We come to the end of the time. We obviously could go on, and I do encourage you to come up and maybe have a chat with Paolo. But I mean, that was a really, really interesting insight into a very challenging part of the world. But it's great to see what the World Bank's doing, and great to hear your insights on it. Thanks also for the questions. I think that was a very good discussion. So thank you very much. Give a round of applause for Paolo.